Behavioral healthcare company that provides psych services. That's their main function. And the reason we built this company, and the biggest issue we have in behavioral healthcare right now, and COVID created some of these problems, but it wasn't it was what that did. That was gas on the fire. We had a behavioral healthcare issue. We got a mental health crisis fueled by opioid epidemic, other drug issues. But generally, we have a mental health crisis in this country. There's no doubt about it. And the biggest issue that we're facing, especially as a state, is access to care. You mentioned Kooth. I'm familiar with Kooth. I don't know exactly their model. It would be really nice for everybody to have access to a psychiatrist and a psychologist in a timely manner. In reality, the reason we started our company is that is not happening at all. You are looking at month-plus waiting times to get to, and that's to a licensed practitioner, not even a psychiatrist or a psychologist. Those times are longer. So what we have to do is really we have to leverage things like technology, like Kooth, to get these services to the kids and the families that are in desperate need of them. The mental health block grant that Aaron had mentioned, going to the schools, sounds like a great idea. It probably is a very good idea. But the issue with it, and what we're seeing, and when I talk to counties, and we have these roundtables, we had a provider roundtable a couple weeks ago. We discussed this in the budget hearings. The money's great, but the problem with that $100 million going to the schools is now the schools will have this money to hire practitioners to come to the school, but they're fighting for the same pool of people, and there's just not enough of them, and they're burning out. And the counties need these people to provide services. The schools need these people the private sector needs these people to provide services. So it is not solvable by just throwing money at the problem and saying, let's try to fix it. We are going to need to utilize tools like Kooth, potentially, with guide rails. I mean, I'm a parent. You know, I want both of my sons to have access to something like this, but certainly I don't want anybody indoctrinated or pushed in a certain path. The idea of psychological care and mental health care is to not push somebody in a path, but to be there to kind of guide them what they're going through and help them process these issues. So I am a supporter of a company like Kooth coming into our schools. We certainly should have some say in it. We certainly should have oversight, but we need to really work creatively. The business world, the counties, the state, and federally, money's dumping into this problem, but we need to sit down and have a nuanced discussion on how we're actually using this money so it's used correctly and we tackle this problem, because we're not headed in a good direction.
If we could keep our questions down to like a 2-minute period, I appreciate your question, but if we could keep it down to a 2-minute period, because we do have legislators scheduled.